But when you look at edibles, when you're looking at the wax, shatter, the high concentration stuff, when you're looking at the actual vapes, the concentration's like 60, 40, 60, 80%. Like that's a lot. And when you're looking at that high potency THC, that can actually mess up the brain. That's when people say like, no harmful consequences. Not necessarily true, especially when a developing brain. Now, first thing you have to understand is you have no idea what's actually in there. Some teens I've talked to, they thought it was nicotine, it was actually THC. They thought it was THC, but it was synthetic THC. I had a teen that's like, yeah, the stuff I use doesn't show up on a drug test, doesn't come up on a THC drug test. I'm like, that's because it's not THC. It's a different chemical that they will combine. It gives a similar feeling, but it also can make your brain tweak out. And this is happening. Sometimes it might be cutting. They might be putting other stuff in there. Like you have like a little fentanyl, like tip of a pencil, amount of fentanyl in that thing, all of a sudden overdose. So that's the first thing. Let's say it actually is that THC. The high potency THC 100% can be habit dependent forming, especially on a developing brain. It's not the same as it was back in the day. It can create that dependence. We also know that high potency THC can increase the risk for things like psychosis with delusional episodes, psychotic episodes. The amount of teens going to emergency room visits because they're like tweaking out has increased significantly over the past few years. We understand it can exacerbate schizophrenia if you're predisposed. We know it can lower academic as well as career success. The big one here I want you to focus on is two. One, anxiety and depression. Some people you might know, they're like, I need to use this as a way of calming down. I need to use this to chill out. What they found on a developing brain, majority of the cases, it actually increases depression and anxiety, the opposite effect of what you're looking for. And once again, can create that dependence on it. If you're dealing with that, there are healthier techniques. The other big one is to escalate to harsher drug use, because I remember growing up and it's like, really? Like smoke a little weed and then jump to heroin? How does that work? Here's how it works. I know a lot of addicts in my family and out. One thing in common with every single addict, not one of them ever wanted to become an addict. True, nobody ever woke up one day and is like, hey, you know what I want to do today? It's a great day. You know what I'm going to do? I'm going to screw up my whole life. What does happen is maybe you have the social anxiety. I don't know how to like socialize. It's weird. It's awkward. It is. Like, how do I socialize? Oh, I can use this and then I can be included? Perfect. I'm going to do that. And now you're training your brain like to be social. I need to use this. They won't like me if I don't do this. Or maybe it's other things. Maybe it's just somebody breaks your heart. Life gets hard. You're like, oh my God, I can't deal with this stuff. I just want to feel good. I don't want to deal with this life crap. You ever feel like that? Oh my God, overwhelmed. I just want to take this substance to feel good to get through this moment. Just to get from point A to point B. This life crap, I'm going to just plop that right over here. Just pile it over here. Then what happens? I didn't deal with it. Then life happens again. Oh my God, I can't deal with this. It's so hard. I'm just going to use this substance to get from point B to point C. Nothing bad happened. I'm not an addict. I'm just using this to try to feel better and to get through these moments, to just deal with life, right?